First slide on there. Hello, doctors. Can you hear me? Am I audible? Hello.
Yes, sir.
Can anyone
Yes,
unmute and tell? Okay, okay. So, doctors, my name. I'll introduce a brief introduction about myself. My name is Dr. Nitin Samuel. I practice in Chennai. I think there are many doctors who are from North India as well. So we'll have the session in English only. Any doubts we can get explain Hindi, Tamil, whatever. So basically, um, I am a periodontist. I completed my PG from Army College of Dental Sciences, Secunderabad. I am a defense brat. So about the Ministry of Defense, about how the setup is there in military services. Being an army brat and my parents being both my brother and father in army, I have a little more depth of understanding on how to get into ECHS as a dental officer. I served in ECHS Tambaram, is a place in Chennai. It comes under the Air Force unit. I served in ECHS for around 3 years, and I came out of ECHS just because to establish my practice and implant practice. So I completed my PG diploma in basal implants. I'm an immediate loading implantologist. I'm practicing for last 4 years. So this is a brief introduction. I did my schooling from Sainik School, Amravati Nagar. It is also a defense school. So in this webinar, my main motive is to educate young dentists and young, and also obviously everybody has a requirement of a job which pays a decent amount of remuneration for our education, especially as dentists. We don't get paid more in jobs. So this is one of the highest paid jobs in India for a dentist. I would say it is less, but yes, obviously, in a competitive world like this, this additional dental officer job will help for passive income, which is a good thing. So to start off, how to get into ECHS as a dental officer? First and foremost, it comes with awareness of your region, in which place you are there. For example, in Chennai, there are there is something known as regional center. The regional center has different polyclinics under it. In Chennai, I'll give an example because I've been recruited in Chennai. In Chennai, there are four main places. One is Island Grounds, which is in near Island Grounds, which is near Marina Beach, St. Thomas Mount, Kanchipuram, Avadi, and Tambaram. So, what major difference is whenever the call for is coming. For example, when you get a call for in from internet from the online website of ECHS or from the newspaper, what will happen is they will give for regional center alone. So you will be eligible only for these four places. That is Avadi, Kanchipuram, Island Grounds, and whatever the place which I mentioned. The polyclinics does not come under the regional center are polyclinics which doc, I have not changed the slide yet, doc. I'm just giving a brief introduction now. There are few polyclinics which many dentists and dental dentists who have passed out, they miss out on understanding is the regional center, they will give a call for separately, which comes under the army. If there is any ECHS which is under Air Force or Navy or Coast Guard, if they are in a separate entity, there will be a separate call for and a separate interview for them, which will actually minimize the competition. Many people will get to know about the generalized ECHS selection board, which comes under the regional center. The individual Air Force, Navy, Tambaram, it will not get notified by many dentists. So basically, what is ECHS? ECHS is Ex-Servicemen Contributory Health Scheme. It is one of India's most funded scheme because there are a huge number of medicines allotted, cancer medicines, diabetic medicines, especially all people who are coming into an ECHS, that is people who is retired from Army, Navy, Air Force, Border Security Force, Coast Guard, they all come under the ECHS, ex-servicemen. and they get facilities such as free medicines, free dental services to an extent, and free hospital empanelment, basically, which is there is known as there's something known as hospital empanelment, where ECHS is associated with hospitals, and people who are not being able to treat in-house at the ECHS center, they are referred to a empaneled hospital where their treatment is done. For dentistry, there are few dental hospitals and clinics which are empaneled with the ECHS. Now, how to get it empaneled? That's another huge topic which needs a separate session. Now we will stick to only the recruitment process and what tips and tricks and what not to do during an interview. This is what we are focusing on. So now the structure of ECHS. The head office central organization is located at Delhi. Regional centers are located at various places across India. In Chennai, it is at Island Grounds. There are different polyclinics at district level. For example, in Tamil Nadu, there are around 22 to 23 polyclinics, which is spread about on different areas. For example, Vellore. For example, Tiruchirappalli, Coimbatore. There are many ECHS polyclinics where dentists are recruited. There are few polyclinics where there is opening for 2 dental offices. So whenever you're applying, if you're aspirant, if you want to seek a job immediately, the sensible thing to do is to give preference. You will have an option of giving preference in the application form when you fill the ECHS. The sensible thing and smart thing to do is just analyze where there are more number of vacancies available. For example, Vellore, which has 2 dental officer vacancies. Even if you're not recruited in one, you are having that possibility of getting into the second dental officer post. So you have to do your research according to your region, where there are number of postings for one particular polyclinic is how much. If there are more number of seats, give first preference for that. Then the second thing comes the interview part. Whenever you're okay, I'll come to the interview part again. So the next thing is you have to apply. Now, how to apply? What are the documents needed? If you can see, this is the application form for the ECHS. This application form is available at the website. When you go to echs.government.in, the website is there, which I'll be pasting at the last thing. Application form. This application form, come back, doctor. This application form, you will have to, for more easier thing, this column of education qualification and this column of experience, which is point number 5 and point number 5HA. Sorry. This part is very important because the person who's scrutinizing the documents, who's sitting in the regional center, he'll get a huge number of documents. For example, around 50 doctors are applying. He will first go through this qualification part. If a doctor is an MDS, if a doctor is BDS experienced of more than 3 to 5 years, this is the basic eligibility criteria. What will matter next is the experience. This 6 number column. You will have to mention each and everything experience in this column, and whatever you're mentioning, you should have the supporting documents which are self-attested. Because one of the main feature of recruiting is in recruiting and seeing a person in the interview is they will see the work experience and what and all procedures they are able to do. So this part, whenever you're filling the application form, this work experience part, you should be mentioning it very, very clear, and the period of employment and whatever the reason for it. So whatever is there, you have to fill your top layer, the empty space. You have to write that for easy communication. What happens is sometimes if your number which you're writing here, you'll be writing the numbers, phone numbers, and email ID, whatever. Whenever you're writing that, if it is not clear or some or the other number is missed, you will have another option for the scrutinizing person to call you. That is, if you can write in the right corner or in the left corner your details clearly in bold letters, your name and your number and email ID. and application for dental officer. Like that, if you can write in the right column or the left column, your chance of getting scrutinized is more, because your the person who is scrutinizing the documents, he'll be able to visualize it very clearly, and there will not be any error. If you give a wrong number or a wrong email ID by mistake, or if it is not clear, you will think you are not receiving the call letter. But unfortunately, it has been sent, but it is, you will never know. That is, if you apply today, you're not going to get the call letter immediately. It will take around 1 month, 1.5 months, because it is they in defense, everything is hierarchy. Each and everything they will follow according to the higher officials. So once your all the documents is collected in a particular date, they will say the last date. After collecting it, they will send a document approval to Delhi that the selection committee has already finished the scrutinizing. We have to now get the approval for conduction of the interview. So this process has to go in a hierarchy. So slowly, they'll go up, and when until the time they come back, it will at least take around 1.5 months for you to get a call letter. If you're not getting call letter for next 2 or 3 months, definitely you should call and ask them that, where I have not received the call letter, when is the interview scheduled? Because you will never know whether you will just forget, and you will not even get your call letter, and it will be your loss, because you're losing without even attempting. So always fall back. At least for after 4 weeks or 5 weeks, you just call and ask, sir, I had applied for ECHS, I have not got my call letter. What is to be done? So they will be explaining that maybe in 2 weeks you will get, or if it is already sent, they will ask your name and details, and they will if you're eligible, they will send, or else they will say some or the other, your documentation is not correct, so you should correct and say you have 2 days, correct and give. So you have that cushion period, that small window to correct yourself. So the most important point of this application form is writing your name and details at the right corner, and this work experience, we write it very clearly, because that is the one which they are going to see for the first time. Next slide, doctor. So now, along with the application form, this is known as certificate of medical fitness. This form will, again, you will have to download and take printout. It will not be coming under the application form. So this particular form, if you will be getting in the ECHS website also, and you will be also getting from normal Google Images. Always when you're getting called for getting an advertisement in website or Hindu paper or any newspaper, this part of application can be easily completed. But this medical fitness form, which is an essential form, you will not even get call letter. You will not know, because of the incomplete submission of documents. This is one of the reason you will not get a call letter, because this medical fitness, it has to be duly signed by a green ink gazetted officer, that is from a government official, or some other doctor from government who is not a gazetted officer, but the seal must be there of the signature of the medical officer. This you should attach with the application form. There are many scenarios and many cases where, because of medical fitness just filled and not got from an authorized organization, people have not been called for the interview. So make sure you get it from a government organization or a government public health PHC, like that, so that this medical fitness is attached along with the document, and there is two set along your documents, experience certificate and medical fitness, education qualification including, and you take a Xerox copy of it. One you keep it for yourself, and one you have to send it in envelope. Dr. Next link. So this is the eligibility criteria. The BDS, MDS, BDS, you should at least have 3 years is the minimum criteria, but they will prefer 5 years experience doctors. MDS, obviously, even there is a small policy which came on February 2025, that MDS must be preferred for if there is any BDS, MDS, MDS must be preferred. But there is no hard and fast rule for this, because the doctor who has replaced me at Tambaram is a BDS doctor. So definitely, if the personality is good, if the communication skill is good, and the interview performance is good, BDS with 5 years experience also will get their credibility. Now comes the registration with Dental Council of India. The DCI registration must be up to date. They will definitely reject and they will not give call letter if the TN Dental Council or whatever state dental council is submitted, but the registration that date is completed. They will see, simple logic. They will want to reject maximum documents just because of the incomplete documentation. More number of people, more number of work for them. Everybody is lazy, so they don't want to scrutinize more documents. So what they will do is, whatever small things, medical fitness not attached, medical fitness not got signature in green ink, or in criterias like Dental Council of India registration is just behind by 1 month, they will not tell you anything. They will just not call for the interview. Another important point is retired armed force dental officers. If we are applying for a polyclinic, Manlo, we are applying for Avadi. If there is a doctor who is retired from the Army, Navy, Air Force as dentist, and he is applying for that particular polyclinic, if you know that he is applying, please don't apply there. Reason being, there is a policy in ECHS that if a retired Army or Navy officer, ex-serviceman in dentistry, who is coming for the interview, you cannot bypass him. He will be the one who will be getting recruited for sure. So, sensible thing again is you have to do your pre-planning. You will get to know, or you, by just speaking to different doctors who are already working, you will get an idea whether that particular polyclinic, retired people, retired dentists are coming or not. If so, don't apply for that. Give your first preference. This first and second preference they will give you. That first preference is a very important aspect, because your recruitment also will be based on that particular idea only. They will be screwed separately whenever the interview is conducted. The first, or at least the second, third question, they will ask you which polyclinic are you interested in. So they will be comparing you with the doctors who are selected for that particular polyclinic only. They will not see the entire thing. So always, whatever is your first preference, is your, make sure it is the best preference. Second preference, obviously you can give, but first preference is always the best preference. Like first preference of the location. Talk next slide. So this is how the recruitment process occurs. Notification they will put in website and newspaper. You have to submit the application offline only. Email, if the person in the scrutinizing aspect, if we say mail it, you can mail, but generally you have to fill the entire form. You should attach your experience certificate, educational certificate, medical fitness certificate. You have to put signatures on each and every printout and A4 sheet what we have used, and you have to send it through speed post or any envelope like that. Now coming to interview. So on one fine day, they will tell you so and so dates are for dental officer interview. Please come by at 9 a.m. This is the tendency. After going there, there will be a board. One board which comprises of dental officers, two, three medical officers, and again one or two uniform officers. So what in general happens is, from next slide, doc. Next slide, doc. Next. What generally happens is, in an interview, keep like this. They will first, the moment you enter, they will see the body language. What I have attended multiple dental officers interview in ECHS. What they will see is the body language. Immediately after walking briskly, you will be asked to sit. For guys, I would suggest wearing a tie, and for lady doctors, best thing is to be as professional as possible. The moment you sit, the first question, maximum time, what is asked is, introduce yourself. This introduce yourself question must be thorough. By you have to practice multiple times by looking at mirror, or by yourself in your mind rehearsing again and again, which will give you full confidence, utmost confidence, because you will be waiting for that one particular question. Immediately, if they say introduce yourself with full confidence, smile, energy, enthusiasm, you can just just uh, fire out what you have kept in mind, what you have already practiced. That first impression only, they will get an impression about you that you're a very confident and a good communication skill having person. So second thing they will assess is the geriatric aspect. Main thing is doctors, patients who are coming there are above 60 years old. All doctors, all patients who have retired from Army, Navy, and Air Force. So the main thing they are looking for is how you will manage a geriatric patient. So understanding about the systemic disorders, that is BP, sugar, thyroid, basic chemotherapies taking patients. So all the medicines aspect, what they are taking, I would suggest you can. When I'm talking about the interview part, you can keep a notebook and just write down the questions which I'm telling, because once the webinar is over, you will not be able to recollect. So basically, first question is all regarding geriatric aspect. If a geriatric patient is coming, what and all procedures you will not attempt if the patient is having so and so history. So understand about all systemic disorders such as hypertension, their medicines which are taking. If the patient is whether on blood thinners, if they are in blood thinners like aspirin, clopidogrel, 75 milligrams, if they are in blood thinners, what and all procedures is to be avoided on the day of the procedure, what and all procedures can be done after 2 days or 3 days of stopping the particular medications. The second thing is diabetic aspect. If a patient is uncontrolled diabetic, what you will do? If they are not uncontrolled diabetic, if they are in a good state, can we do the extraction procedures? So systemic aspect, medicines which have been taken, whether they are on the medications which is orally taken or whether they are taking insulins for insulin injections as because of the uncontrollability. So everything related to geriatric, first you have to prepare step by step indications and non-indications of treatment to be done, mainly about root canals and extractions. Second thing they will ask is medical emergencies. Doctor, doctor, next slide. Next is the medical emergencies. Medical emergencies, first and foremost, syncope, that is bare minimum. Everybody will ask, what is the common complication? Apart from that, whatever the complication and medical emergency drugs, what we'll have to use during during any procedures, what is the complication of extractions, impactions. So complications and medical emergencies is one of the most important part what they will be asking. Second thing, in basic emergency, what you will do, that is a basic life support, doing a CPR. What is the procedure of doing the CPR? How you will administer adrenaline injection? There is an automatic injector, whether you will have it in the polyclinic or not. How you will be giving anybody who is having chest pain, what is the immediate action you will be taking? Whether you will give them aspirin or whether you will immediately take them to the hospital. So these are the all things, this all situational they will give according to your reaction, and they will be firing with you with more question inside the same topic. The third important thing which they will be asking is, if you are a periodontist or if you are an oral surgeon, if you are an endodontist, be thorough with your subject, because even you're not able to answer few questions, they will come to your own department. They will come to endodontic department. If you are not able to answer that also endodontic aspect also, your selections of your chance of selection becomes extremely way less. So the basic thing is whatever related to the geriatric aspect, medical emergencies. Third point about your own specialty. Fourth point is non-dentistry, which is about, you should, while going to the interview, you should know about ECHS first, the history of ECHS, when it was started. Doctor, hello. Doctor, please, we'll have a question to answer session. Till then, unmute talk kindly.
So,
So, so basically, what is the most fourth, the most important point is you have to understand and learn about ECHS, the history of ECHS, when it began, why it was started, when it was started. who was the person who was the initiative for the ECHS. And coming to the ranks in Army, Navy, Air Force, what is the rank from Shubedar Major, Shubedar, from to the officer cadre? How the ranking system starts? Lieutenant, left captain, major, lieutenant colonel, colonel, brigadier, lieutenant general, major, like that. You should understand about the ranking systems of the defense forces. This is a point because they will check whether you will show any differences in terms of treatment offered to an officer or a JCO NCO. So that point, generally they will expect if you're able to tell about the defense forces and basic ranking system of it and how passionate you were. This is an addition point which you should keep in mind, that you are very much into serving the defense people because they have sacrificed so much in their life for benefit of all citizens of India. So what is from your side you want to do? So whenever you're giving an interview, you should tell that part, that it is a great honor for me. I've always wanted to join the defense forces. I have not got the opportunity. At least if I get an opportunity to serve the people who have already been in uniform, it will be a great achievement and a great privilege for me to serve such people. And also, definitely, the remuneration part, the salary part, I'm very happy about it. As dentists, we don't get paid in much in the jobs unless and until they have their own clinical practice. So people will be happy about your transparency, that obviously you are come here for the salary, and also people will be honest about happy about your honesty of how you feel about the defense force. So always mention that you're a very passionate person about the country. You are a very patriotic person, and you feel for everybody who are in the uniform. You have that empathy, sympathy for them. And you will be able to do whatever best possible for them. So you should convey that in a very clear and a precise manner. So generally, that contractual job, it is a contractual job. You will, whenever you are getting recruited, you will be signing a you'll be you'll be signing a document on 500 rupees stamp paper. So what you will do in that particular point is you will have to completely go through whatever the clause which they have written. One of the main clause which they will be written is the non-practicing thing. So it is not a hard and fast rule for dentists. We are mainly here for earning. We have done our hard studies and we have hustled so much, obviously to earn well. But if they are saying there will be a small point mentioned about the non-practicing thing. It is actually there, but nowhere in India, maximum people who are recruited as dental officers have their own clinical practice, and they do go for job, that is morning 8 to 4, and after that they will go and practice in their own clinic. This is what is happening universally. So there is definitely a clause of non-practicing, but it can be waived off with permission from the officer in charge and the officer in charge of the entire ECHS. So, so that part you have to keep in mind for practitioners. So this is an added advantage for non-practicing doctors who are employed or who are looking for jobs. They can more proudly and more confidently they can tell that part, that I'm not working elsewhere. This is the only place I want to work, and I'm ready for working at any place which I'm getting recruited. This will give them more flexibility for putting you into your second preference, what you have given. Another most important point you should consider to keep in mind is whenever you're asking whenever the interviewing officers, they are asking which place. If you are saying uh, Tambaram, for example, whenever they ask where do you stay, the residence, always you should tell, even if it is a fake thing, do tell them that you stay nearby, and it is very easy for yourself to commute, to go, come back, and come forth. Because if you are staying nearby, this is a trick basically. They will, whenever they are doing a discussion post the all the interview, they'll be talking about, for example, Dr. Soumya. Dr. Soumya is staying in Tambaram. She'll be able to commute, come and go very easily, and her location is nearby. She'll come on time, she'll leave on time, and she'll be more involved in the organization work at ECHS. So that will give them an added advantage. So always when you're going for a particular location, Trichy, just tell them that you stay nearby the ECHS polyclinic in a nearby location. That will indirectly give you a boost and an added advantage than other doctors. Next slide. So, what is the advantages of joining the ECHS? First thing, you are exposed to a huge number of patient flow. Around every day, there will be around 10 to 13 patients which you can be able to treat. You will be able to perform extractions. You will be able to perform GIC composite fillings, aesthetics procedures, whatever is limited. Crowns are not eligible in by dental officers who are recruited. They are referred to MPanel hospital. And the fourth most important point, implants, dental implant treatment. Since there are number of geriatric patients who are having missing tooth and they are unable to replace their teeth, it is very difficult for them to get treatment in ECHS, which is the blunt and the honest truth. Only treatment modality which is eligible in ECHS is the RPD, removable denture, and maximum FPDs. That too, many empaneled hospitals doesn't do. So, as a doctor, if you can educate them about the importance of implants, they will be able to be motivated, and they will be able to know and understand the consequences of not having a tooth replaced, and at least they will have that scope for going outside and doing and get their money's worth. So it is all a dental officer's job to educate them, to give them more awareness about their dental health, and what will happen if they are ignorant about their dental health, and whatever is possible within the limits of the ECHS and the resources provided by the ECHS, you can go ahead and do whatever you want. You have full free hands. Dental officer is the only one, he is the king. He should be the one who is to be decide whether he has to do the particular treatment or not, or whether he has to do the extraction. So more number of patients, more number of more communication skill will improve, more hand skills will improve, and moreover you will be networking with different defense personals. You will understand about the defense setup. You will be more disciplined. You will have a routine in your life. You will be able to communicate and have a good bonding with the fellow employees, and it will all obviously give you a good advertisement for yourself. If you advertise yourself as an ECHS dental officer in your clinic, if you're advertising and explaining about patients, about your work you've done in the ex-servicemen health service, there is definitely an added advantage and a career growth, which is very important in current competitive scenario. What are the challenges which we are facing? There are number of openings are limited, so we have to be keeping on looking on the website only. When the vacancy will arise, you will never know, because see, if a doctor is getting recruited in August, the doctor will be serving 1 year at least in August, till August. So even if you are getting selected in June, if they are calling for the call for, if you're getting selected in June, till the doctor completes his tenure in August, you will not get a call. You will not get called for. Even if you're selected, you will never know. So what job is ours is to attend the interview blindfoldedly. Your work is to fill the form, send it at the correct time with all documents correct, all medical fitness reports correct. Your work is to send them. They will give you a call for in your email ID, and they will send a text message in your phone explaining about the MCQs questions. In MCQ questions, what needs to be prepared is the basics of all subjects. So they can ask anything. Even they have asked dental anatomy, histology, embryonic stage, vagera, that we have obviously, after doing so much after our BDS and MDS, we'll not be able to remember that minute details and all. So this MCQ part, it's purely individual based. We cannot control it, but the remaining aspects are controllables. How you are going to give your interview? How is your mindset? How is your confidence? how we are going to do body language in front of the officers. This everything you can rehearse by yourself in mirror at your home, and you can do whatever best possible for you. Second thing is dog backpack. Short contract duration. See, every year you will have to attend an interview to get your renewal to sustain in the same polyclinic. There is a policy in ECHS that a doctor can stay only till 4 years maximum at a particular polyclinic. So if you're coming to know in your city or in your regional center that a doctor is staying for 4 years, more than 4 years, you have all the rights to talk to the organization. It is not that we are jealous of anybody or criticizing anybody. It is all about the opportunities. If a doctor is staying more than 4 years without competition, if you know about the policy, you are all in the rights to question the organization, to keep an interview, to relieve that doctor, so that another vacancy arises and you get an opportunity to get into that. So that part is the research are meant to be done by the doctor themselves on that particular region. As a policy, a doctor cannot work in the same polyclinic for more than 4 years. This is set. So uh, another thing which I want to mention is, in some polyclinics, that is, which comes under a defense board. For example, Tambaram, where I served, it is under Air Force. There is a small added advantage of joining in the Tambaram Air Force Station in Chennai, because in such polyclinics, due to some power given by regional center, I think so, I'm not very sure about it, but a doctor, if he is getting recruited in Tambaram Air Force Station, they stay there for 2 years without interview. So you can be rest assured that you are going to be there for 2 years, and you can plan accordingly your personal life for in and around Tambaram. You can stay, you can bring your family. So that part for other states and other regional centers, I'm not very sure. But definitely in Chennai, there is in Air Force Station, people stay for 2 years. The third point is documentation delay. If you are delayed in submission even one day, they will not going to encourage you, or they notify you that your documentation has reached late. And last part is lack of awareness. So this lack of awareness, this webinar was to increase the awareness. My main motive was to increase the awareness for all the doctors, to have an eye on an opportunity like this whenever it is coming. Because see, attempting and trying is only in our hands. Getting, not getting, it's all a thing which is not under our control. So if you are competitive, if you are having good knowledge, good strength, good communication skill, good moral responsibility, you can definitely, even BDS, you have good experience, you should definitely try. The one best inspiration is the doctor who is working in replacing me. She is also a BDS. She is not an MDS, and she is doing well. So the main thing is your maturity level, confidence level, and how well you can convince them that you deserve to be there at the dental officer post. Because once you are inside, you are part of the family. So there are greater scope for you to getting selected in different other polyclinics after once you are stepped in your leg inside, one foot inside, one inside the line of ECHS. So these are the main part which I wanted to explain. Now we'll go for the question answer session. I'll be explaining whatever the questions you'll ask me. So whoever doctor is wanting to ask question, he or she can unmute, and they can ask the question. పోతుందా? Doctors, any questions?
Good evening, sir. Thank you for the webinar. Is there any vacancy, sir, in the Tamil Nadu or in Chennai? Any idea, sir? Or should I
In
be
which
in
place,
different
doc? In which
places?
place?
Tamil Nadu or Chennai, sir. I am actually from Chennai.
Okay. One minute, doc. 1 minute. Uh, Doc, in Chennai, if you see, there is the vacancies are in Kanchipuram, Avadi, Island Grounds, St. Thomas Mount. Vellore also comes under the regional center of Chennai, and Pondicherry also comes. Hello.
Okay, sir. So we should go through the website and fill the application form and go to that
Doc,
place and give the application, sir.
doc, your audio is not clear to me, doc.
Just
Can you text message in the chat box?
yes, sure, sir.
Okay. Meanwhile, while the doctor is text messaging, I would like to also tell that the group which we have formed now, me and we are implantologists, basically practice periodontist and implantologist. We are having an idea of, okay, well, I'll just answer the question first. Good evening, sir. So we should go and give the application form in Avdi or places in Chennai. Actually, no, doc, you should not go directly. If you can go, okay, if you're in Avadi, if you can go and meet the officer in charge who is in the ECHS polyclinic, and you can tell them that, say, doctor, sir, I stay nearby, and I'm a very equipped and a competent doctor. I do so and so procedures in a very efficient and a painless manner, and you can boast about yourself, like about your skill level and about your experience level to the officer in charge. Now, what happens is, whenever this is all timing, if you're at the right time at the right place, everything can get clicked. So at the time of interview, when they are calling, I think recently, around 2 3 months back only, they concluded. So if I'm saying for the future, just go and speak to the officer in charge once, telling your name and I'm Doctor So and so. What happens is, whenever the interview is coming, the officer in charge of the particular polyclinic have some amount of say in the interview, because the people who are from the regional center, they will ask the officer in charge of a particular polyclinic about the character, about the personality, about the experience of the doctor who is already serving there. If the officer in charge does not have a good rapport and he is not satisfied with the particular dental officer's work, he will say that she is not that good, but I know a doctor who is very good and she is very nearby also. She'll be able to come easily and commute easily, and she's also very efficient. You can consider her karke, they can tell your name. So this part will be helping you on the interview day. You getting it, doc? Hello, doctor? Okay. So anybody else wants to ask any question regarding the recruitment process, and you can unmute and ask.
Sir, I have a question. If we already have a private practice, how can we convince them?
Doctor, the practical aspect is, who the ones who are having a private practice, they should not apply only according to the documentation what they have. But as dentists, our main livelihood is because of our clinical practice, and nobody is going to get peace in this current competitive generation and scenario. No one is happy with the particular salary of 75,000 or 67,500, which comes to our hand after tax. The 10% tax they deduct, and you'll get a salary of 67,500. Nobody, at least doctors who are having a family life, there's not a salary which we can run a family. So what happens is, many doctors, including general practitioners, I'm saying not only in dentistry, even doctors who are recruited for medical officer, everybody, 90% will be having their own clinic and only they will be practicing. So this practical part is understandable by every doctor and every organization. So it might be a problem when and another doctor who's in your same region, she does some questioning on how she can practice like that. So it might get an issue. You can tell that it is your husband's practice, or it is your wife's practice, or it is your relative's practice. I'm just working here. So if you are able to counteract like that, also this point will not go ahead. But definitely 8 to 4 is the timing of the job. It is a worth it job because our main clinical timing and aspect is everything in the evening, dentistry business. Busy practitioners, morning obviously very tough. For initial stages, morning session, doing a job, and evening will obviously help in passive income. So what I would suggest is, what I would want to say about this question is, doc, definitely try. Don't, your main aim is to attempt. You're getting and not getting, and you're having this clinic, and then can we practice or not question and all comes later stages. After getting in, if you have signed the document, that is 1 year contract, nobody can send you within that 1 year. They can obviously make some issues and stuff which will waive off, but that 1 year you will serve. That is for sure. Nobody can take you out because this is consumer right. You will not be able to. You will not be sent out without completing your tenure. So you need not worry, doctor. Doc, you got your answer?
Got it, sir. Thank you.
Mm. Any other questions, docs? Okay. Before we end the session, I would just want to suggest that we'll this group which we have created now for this webinar, we as periodontist and as implantologist, we do a lot of difficult, complicated surgeries, which might be beneficial for every doctors who are in this group or in general. So what we have planned is we are going to record our videos and record our surgical videos, and tough cases we will be posting in this group and discussing so that we all can learn and grow. Everybody will have their own opinion on treating different cases, on handling different cases, on handling different experiences. So I would like to tell all the participants who are currently present to make use of this group very well. I'll be posting more webinars also. We have another doctor with us, Dr. Rajshekhar, who is a strategic implantologist who does extreme tough cases. We can get in insights from him also. So this platform we will utilize for more uh, equipped and more webinar, which will be increasing the productivity of all dental practitioners and dentists, and lot more things which we have planned. So this I wanted to convey, that don't exit the group or don't go immediately, because there is a huge vision for this group. We are going to increase in more number. So I would just advise and suggest to make use of this WhatsApp group to all participants. So, doctors, if there is no question, can we end the session? Doctors? Okay, okay, doc, we'll end the session. We will discuss the remaining everything in the WhatsApp group.